This is an ultrasound study of right kidney, in which you will see cyst number 1. This is a small sized. This is bit larger. This is now they vary in sizes, and they are seen in the renal parenchyma, in the region of renal parenchyma. This is the capsule of the kidney. It is not distorted, and this is the central sinus echo complex. This area is the central sinus echo complex fat. This is the cyst. This is cyst. This is cyst. This is also a cyst. And similarly, the cysts are seen in all regions. This is again a cyst. This is a cyst. In the upper pole, mid region, as well as in the lower pole region. You can see cysts in all the regions. Now you source a little. This is a cyst, this is cyst, this is, so these are all cysts. This is cyst, this is a cyst. Now, none of the cysts are communicating with each other. Point number 1 to remember, the outer surface is now distorted. They are of variable shape, but their outer margins are not that distorted. None of the cyst margins show distortion. Central sinus echo complex is seen. So this is a multicystic kidney, and the cyst will be seen in the parenchymal region. They do not involve the central sinus echo complex. Now, all that I have said, the opposite of this you will see in polycystic kidney, in which the cyst will vary in size though, but they will bulge around the capsule. The capsule will also bulge with the cyst. The central sinus echo complex will also be involved in polycystic kidney. Adult kidney, though polycystic kidneys are more common in childhood, but however, adult polycystic kidney is a documented entity. In this case, however, in this case of multicystic kidney, you see central sinus echo complex is present. The cysts do vary in size, but they have regular margins. These cysts have regular margins. This is the largest one, which measures 24 to 18 millimeter, whereas in polycystic kidneys, they vary in size between 15 to 20 and are seen above the age of 40 usually. And they remain asymptomatic, and the patients usually present with renal failure in polycystic kidneys. So I am also giving you the differentiation between polycystic kidney and the multicystic kidney. Presently what we are seeing is a multicystic kidney and not a polycystic kidney. Now this is also small cyst, this is a cyst. See, there are tiny cysts as well along with the larger ones, and they are not communicating. None of the cysts is communicating. Secondly, they are seen in the region of the renal parenchyma, and spares the central sinus echoes. Now you can yourself make out that this is a cyst, this is a cyst, this is a cyst. So this is how, and they are internally clear. None of the cysts show internal echoes or any calcification. This is, see, this These are small cysts. This is a cyst. This is again a cyst. This is a cyst. See, they spare the central sinus echocomplex and are seen both in the upper pole and in the lower pole. The size of the kidney in multicystic kidney usually is within normal. So let's measure this kidney. In longitudinal section, it measures 10.9 centimeters. 11 up to 11 is normal, so this kidney is normal in length, and it measures 4.5 centimeters in anterior posterior diameter. So this kidney is normal in anterior posterior diameter, as maximum upper limit is 5. So the kidney is within normal limits. And in transfer section, एक लंबा सा लेके सा रोक लो. You can see that renal vein is entering the hilum. This is the renal vein entering the hilum region, and now you will be able to see the cysts. See the cyst in transfer section. This is a cyst, all involving the renal parenchyma with central sinus echocomplex spared. The outer surface of the kidney, the capsule of the kidney, is regular, smooth, and no bulging is seen. So this is an adult polycystic kidney. Presently we are studying the right kidney. लंबा सा सर रोको. You can see this is at all locations of the parenchyma, the smooth wall of the cyst. Now let's see the left kidney. Passa mere Passa mere बस ज़्यादा नहीं, थोड़ा जा परे. Now this is the lower pole of the left kidney, where you can see, identify number of cysts. This is the larger one. These are the smaller ones. So this is all usually bilateral condition. Read the number of cysts. So these are at the upper pole, and this is the lower pole, and now you read the cyst. This is cyst, this is cyst, this is cyst, this is a cyst, this is a cyst, and this is the parenchyma of the lower pole of the left kidney. So these cysts are well outlined. They do not communicate with each other, and you will also see that the parenchymal thickness is normal. So in the mid region, again you can see number of cysts varying in size. The cysts do not communicate. They spare the central sinus echocomplex. This is the central sinus echocomplex. All that you are seeing, the opposite of this you will see in polycystic kidneys. This is an adult polycystic kidney. You can see there are uncountable cysts in this kidney. This kidney contains more cysts as compared to the right kidney. Upper pole, mid region, lower pole, lambasala, row. Seen at all regions. However, in this case, we can too see some tiny calcifications in the region of central sinus echo complex, which is an unusual finding. This is a tiny calcification giving posterior shadow. It is in the region of the central sinus echo complex. In this kidney, the central sinus echo complex is a bit muffled as compared to that of the right kidney, but it is present. However, there is no cyst in the central sinus echo complex, whereas there will be cysts involving the central sinus echo complex in polycystic kidney. So this is a case of multicystic kidney. Anyway, this is the left kidney, and you can see the number of cysts in this kidney. There are much more cysts in this kidney compared to that of the right kidney. This is in the parenchyma, and the outer surface of the kidney is smooth and regular. However, the central sinus echo complex does contain some echogenic areas, tiny echogenic areas, some giving posterior shadow, some are not. So this is a case of bilateral multicystic kidney. The size of this kidney is also appears to be within normal, and let's measure it. Saroflow. This is the length. It measures 10.2 centimeters in length, maximum is up to 11. So this kidney is normal in length. It measures 4.4 centimeters in anterior-posterior diameter, and this kidney is normal in anterior-posterior diameter. 40% of cases of polycystic kidney will have cyst in the liver as well. However, in multicystic kidney, it is not expected. So this is if you want to see this picture, always differentiate between polycystic kidney. So the largest cyst in this kidney is this one. This is the largest. It measures 13.6 millimeters. Is at the upper pole. So remember this configuration. So the size of the cyst is important. It does not range above 15 centimeter, and secondly, its outer surface is smooth. Thirdly, they are present in the parenchymal region, and number 4, the capsule of the kidney is not disturbed. You see, the capsule is intact. These are the differentiating points, and their size vary. They do not communicate with each other. एक लंबा सा सर रोको. This is an ultrasound of the female pelvis with in the longitudinal section. This area is the urinary bladder, and this area is the uterus. This is the uterus in longitudinal section, and from here you see a cystic area from the right adnexa Now this is the uterus in longitudinal section, measures 7.0 centimeters in length, 3.2 centimeters in anterior posterior diameter, and this is the transverse section of the uterus. This is the transverse section of the uterus. It measures 4.6 centimeters. It is normal, very normal. Again, longitudinal. This is the urinary bladder. This is the urinary bladder, partially filled. This is the uterus. And this is a cyst that you can see is black totally because of fluid, and you can also see acoustic enhancement or posterior strong back wall of the cyst. We will follow the cyst later on. However, in this view, you can see that now I'm going to follow the cyst, keeping in first of all informing you this is the cervix, and this is the endometrial canal. This is the fundus of the uterus. This is the anterior segment. This is the posterior segment. And now if I am going to follow the cyst, you see this is a huge cyst that is extending from the region of right adnexa in the midline up to the umbilical region. You see here again. Now this is the cyst in the midline. It goes up to the umbilical region. It is thin-walled. See the acoustic enhancement, back wall, strong back wall. It's internally clear. This cyst is internally clear. There are no internal echoes. There is no calcification. There are no septas, and there is no solid element seen in it. Its outer surface is thin. It is a thin-walled cyst. See, this is its outer surface. This is the outer margin. So this is a huge cyst, ovarian cyst, that is extending from the right adnexa in the midline up to the umbilical region with an approximate volume of, it is too large to get it in one single view in total. However, its average volume is, this is the longitudinal section. Is something around 2.2 liters, even more than that. It will be more than that. 2.2 liter is that we are getting by ultrasound. However, when surgical intervention will be done, it will be, the size will be more than we are getting in this ultrasound study, and its volume will also be more. So a margin should be kept. This is the outer wall. You can see the posterior wall is strong, or the acoustic enhancement behind the cyst. So this is a case study of a